I believed in chiropractic because it helped me. I had a neck injury. I had electric shock go down my arm and electric shock go up the side of my head. I had headaches, and I even had a stinger, which was temporary paralysis, which went away pretty quickly, but it scared the living daylights out of me because I spent like 30 to 60 seconds not feeling my body. And so I went to a chiropractor, and that was all pretty orthopedic kind of stuff. You know, the neurological stuff was a little bit more of a layer to it, and I knew the chiropractic was very powerful because I did the medical care first. They just put me on drugs. I wasn't getting better. And when I started going to chiropractor, I started seeing amazing results. So I was really sold on what chiropractic could do. When I went to chiropractic school, I started hearing stories about chiropractic affecting organs and curing other things. And I'm like, I don't know if I buy into all that. But the more I practiced, the more I went to school and learned more, it made sense to me that, you know, if you have a problem with part of the spine and it's affecting a nerve to a body part, you could have something respond that has nothing to do with what people would think would be an orthopedic problem. So one of the first things that ever happened to me was, I remember this patient came in. She was a new patient. I won't use her name. I'll just say Mrs. Smith, because all of my employees went to the local high school, Avondale High School, and she was a teacher. And they saw her coming in and they're like, oh my God, it's Mrs. Smith. And I'm like, who's Mrs. Smith? And they were like, she's the meanest teacher at Avondale High School. So they were all afraid of her, and they were all graduates. And I thought it was kind of strange. And then I met her, and she was very much to the point, and I was like, yeah, she's very, very, very direct. And so I did my workup on her, took x-rays. She came in. I said this was her problem. Her complaint was neck pain and sinusitis, but mostly the neck pain. So I said, yeah, you do have some degeneration in your neck, and I started to treat her. Well, I gave her the first treatment, and I remember the next day was Tuesday morning. That was a Monday night. Tuesday morning, I didn't have patient hours in the morning, and I was doing stuff with x-rays. And I remember my office was set up, it had a long hallway, and I saw her in the parking lot coming, marching in, and she comes walking in, and I had somebody at the front desk, and she goes, where is he? And I'm listening to this, and they go, well, we're not open right now. I want to talk to him, where is he? And she looks down, she sees me, and I'm like, with x-rays in my hand, and she comes marching down, and she says to me, what did you do to my nose? And I'm like, what? What did you do to my nose? I didn't do anything to your nose. You did something to my nose. I haven't been able to smell for the last 20 years, and I can smell. I spent the morning, and she starts crying. I get emotional. But she starts crying, saying, I spent the morning in a flower shop, and then I went to my daughter's house, and I could smell the baby. And I haven't been able to smell in 20 years. What did you do to my nose? I was like, whoa, I didn't expect that. But I had that happen quite a few times with different things. And you know, why is that? How is that? Well, you know, I was taught in school the garden hose theory, which I don't know if I really subscribe to that. Oh, you get a kink in the hose referring to the nerve as a hose. But what my wife did was she explained to me, look, she was a head injury therapist. And when she wakes people up out of a coma, what they do is they take that comatose patient, they put them on a tilt table, they strap them in, and they tilt them into a weight-bearing position while they're in the coma with a strap for their head or a collar for their head so their head doesn't fall forward. And if you think about that, what you're doing is loading the weight-bearing joints, which have nerve endings called mechanoreceptors and proprioceptors in those joints. And by putting that patient in a weight-bearing position, it stimulates the proprioceptors, which triggers a process in the brain called synaptogenesis. That is the creation of new pathways in the brain just by weight bearing. And when I learned this, I was like, that makes sense. So if they have a weight bearing joint in the spine, because remember, 90% of the weight bearing joints are between sacrum and occiput. If you have a vertebrae that doesn't have proper biomechanics and it's not moving properly, it's not stimulating the proprioception, that part of the brain is going to be affected adversely by that lack of information. And the reason my wife fell in love with chiropractic is when she realized these guys were unsticking weight-bearing joints, they're restoring the input back to the brain. She called it the keyboard to the brain. The weight-bearing joints are the keyboard to the brain. And if you have some of them stuck so they don't work, it's like having a key on your computer that won't work, it's going to change the program. And by restoring that, the program goes back to normal. And that's what I discovered was happening. One other story I'll tell you. I remember a woman came in and she came the next day and she goes, could what you do affect my fingers? It was after her first adjustment. I'm like, oh, of course it could. And I showed her a nerve chart and she goes, because look at this. And I'm like, okay, I can do that. She goes, I couldn't do it yesterday or for the previous 15 years. I had what's called trigger finger. My finger was stuck like this for 15 years. And I've been to different surgeons and they said they could try to release it, but I didn't want to get the surgery. So I didn't, and all I did yesterday was I came in here, you adjusted me, and I woke up today and I'm doing this. I'm like, that's really amazing. Yes, that could be caused by what I'm doing because I'm restoring communication with the brain. So don't be undersold on what you're doing with these patients. When you are restoring this pathway, my wife, a physical therapist who specializes in traumatic brain injury and stroke rehabilitation, recognized that what we're doing has a direct positive impact on the function of the brain. And you can't do anything better for anybody with any type of ailment than that.